Hello, everyone, and welcome to Eisenhower Health's Lucy Curci Cancer Center lecture. Thank you for joining us. And my name is Brett Klein. I am with Eisenhower Public Relations and Marketing. And we're happy to have you here today with us for a very important topic and one of my absolute favorite speakers, Alison Mayer Sachs, and she'll tell you more about herself and all the fun stuff. But a few housekeeping things. This is a webinar, and so right now everyone is muted as well as no video. What we will do is as we get closer to the end, Alison will conclude and then she will open it up for questions. And I will serve to go in and unmute everyone. Feel free to use the chat feature within the Zoom's program. And if you have a question during, and I can read those questions, feel free to as well raise your hand. If you have a question at the bottom in your bar, you'll see a thing that says raise hand. That will give me an indication that you would like to speak. And then I will go in and unmute you. Ideally, we'll hold most of those till the end or until Alison gives us a heads up. So with that in mind, I'm going to turn it over to Alison and we'll get started. Alison, welcome.
Well, thank you so much, Brett. What a nice introduction. And the truth is, this is probably my favorite thing to do, which is speak with all of you and share information and get a dialogue going back and forth. And we'll do that with questions at the end. And I look forward to hearing your questions and your experiences with using the internet for information. I am the Director of Community Outreach and Cancer Support Services at Eisenhower's Lucy Curci Cancer Center. I'm also a certified oncology social worker and have been an oncology social worker for a little over 40 years, which continuously amazes me when I say that. So in all those 40 years, one of the things I have really learned the importance of from the patients and family I work with is information. Everybody wants information, how important it is. You know, what's information? It's education, it's knowledge, it's learning. And as we all know, and if we heard continuously, is information is power, knowledge is power. An informed consumer, and make no question about it, cancer patients of any kind are consumers. We are the ones who are using this medical care. So we know an informed consumer is a better consumer, is someone who knows what the information is they need, how to ask it, where to get it, and what to do with it. So that's what this is all about. And, you know, as we well know, where do we get the most information that we have? Brett, I need your help. I'm so sorry. I did push my buttons and nothing moved. Oh, thank you. So let's start with the premise and the understanding that not all information is necessarily good information. Okay, we have to be very careful. We have to be smart consumers of that information. We need to go to the right places to get the right information. And what is that? It's the information that benefits us the most, that makes us understand better. In this case, we're talking about cancer, makes us more informed cancer patients and the loved ones of cancer, because that in turn helps us be a better part of our team, because that's what it's all about. Excellent care is when you work in a team approach with your nurses and your physicians and your social workers and your medical assistants and all the other folks that make up your healthcare team. So if we know not all info is good information, what we do know is there's one place that we all go to first. And, you know, when we used to do this lecture, we used to say, well, you know, we have an older demographic here in the desert, and most older people, although I'm one of those older people, so I no longer know what that means, but older people don't use the internet so much. Well, guess what? That's not true anymore. That truly is no longer the case. The majority of people over the age of 65, 70, 75 are internet savvy, they're computer savvy. So there's tons of information. All that's to say, again, is when I need info, where do the majority of us go? We go on the internet. And the question becomes, what do we do with all that? Is it helpful when we're trying to make treatment decisions, when we're trying to gather information? Is all of that coming, I love this graphic, by the way, coming at you? How helpful is that? Or is it overwhelming? Is it to the point where you're going, whoa, whoa, wait a minute, that's just too much for me? I think it is. It's been my experience. I've watched this. Just today, one of our oncology nurse navigators said to me, yeah, you know what, Allie? I had a patient call this morning and we went through all her treatment and I know she took some notes and things were great. And then she called me back maybe half hour, 45 minutes later with more questions. And I knew she'd just been on the internet. And the thing is, those questions weren't as helpful to her and didn't give her the information she needed. So what do we do about all this? Well, the first thing is to recognize it. Okay, remember, be a good consumer, know what you're reading, know what you're looking at. I can remember when I first was putting this presentation together and I was looking for some information on the internet. I was, honestly. There was a great study that I came across that Microsoft had done. And what they did was try to figure out what we call a query escalation, or questions one after the other. What happens when we go to the internet with some fairly common symptoms? So what they did, they used, they used thousands of experiences. And what did they find? Well, when someone typed in headache, by the time they were done, question after question, oh, let me go to that site. Oh, yeah, I see with that information. Let me follow that site. What did they end up with? They started with headache. They ended up with brain tumor, when they probably had something like a coffee headache because they had cut back or stopped drinking coffee altogether. So it's so important to understand, one, how to use the internet, right? And two, where's the information coming from? Because only then can we assess, is it good? Is it helpful? Can I use it? Does it pertain to me? So information on the internet, I mean, look at the slide. It comes from so many different places, and it can come from the places we like to go to. Look at the top three: expert health organizations, and we've listed some of them down below, government agencies, universities, and then we start to get into a kind of a gray area: merchants. Now, there's nothing wrong. We're a capitalist society with people selling things. They can be very helpful. Again, just the other day in our breast information and support group at Lucy Curci, we had someone who's preparing to go into surgery and was really concerned about, when she came home after breast surgery, putting the seatbelt over her chest. And we were able, the group jumped in and said, hey, I had this kind of pillow or that. I was able to quickly do an internet search and share with her a place to buy a pillow. So I'm not saying merchants and people selling you things aren't a good idea or aren't helpful, but you have to know who's selling you, what are they selling you, and do you need it? Why are you buying it? And also, can it hurt you instead of help you? And then we look at interest groups. Those are folks who, they're on the internet because they have their own agenda. Again, not necessarily unhelpful, but certainly not necessarily helpful. And then, of course, we get into we got to be careful here. And those are the blogs, because that is definitely someone's personal opinion. And when we're talking about cancer, no two patients are the same. Everyone is unique. Don't we know that now? Aren't we just hearing and learning about the genetic makeup of cancer cells for each individual is the best way to treat you? So no, blogs are not very helpful. They can be very entertaining, but they're not helpful. And then, of course, we get to scams, and we know scams are just what they sound like. Not a good idea. So let's pay attention. Where does it come from? First questions. Is someone trying to sell me something? And the internet is very anonymous. You and I, well, actually, Brett explained to me, I can't see you guys in this format. You can see me, but right? They can see me, Brett, right? Yeah, but I can't see you guys. So the internet is really anonymous, which allows scam artists to flourish. Nobody knows who they are. They can't find them. The internet address can be a phony address. It may look very professional looking, but you have to ask yourself, is that real or is it bogus? So we always have to remember, sorry, There we go. We always have to remember that when we put anything into the internet and we want to know, is it good, is it bad, bogus or not, are they selling me something I don't need? What we're using are search engines. And search engines return sponsored findings with your search results. So they look a little different than other results. Usually they start with their ads. I've noticed recently it actually will say when I use Google search, it'll say ad, very tiny. I have to really look for it, but it'll warn me that while it's saying prostate cancer information, next to it, it says ad. Right below it is exactly the same title, but the ad word isn't there. So that's how I know it's reputable and I want to look at it. It's not just an ad. So we have to be really, really thoughtful and attentive to what we're reading when we Google something. So here's an example. Oh, I did put in prostate cancer research. So I typed in prostate cancer and it was just a Google search. And you know what Dr. Google told me? She told me that she had 102 million results in 58 seconds, 0.58 seconds. That, first of all, that's ridiculous when you think about that. But this was the first result that came up. www.protons.com, pay attention, / prostate cancer specialists. So who do you think that is? Obviously, it's a group, maybe a fabulous group, maybe a wonderful group, but it's a group selling me their prostate treatment options. Is that what I wanted when I was looking for prostate cancer information? I wasn't looking for someone to sell me to come to their office to get treated, was I? No. I was looking for information to help me better understand my husband's prostate diagnosis, which he didn't have. I'm using that as an example for those of you who might know my husband. Okay. So here's the questions to ask. If this comes up, you're supposed to stop and go, no, something's wrong. That's not what I was looking for. I wasn't looking for someone for proton beam with a phone number and address and where to go to get treated. So ask the questions. Who runs the website? Who's paying for it? Is it run by an individual? Is it run by an organization? And if it is run by an organization, what type of organization? Because that makes a difference. An honest website, an honest site makes it easy for you to know about them, often by just clicking About Us. And it's usually found at the top or the bottom of the homepage of the organization. That's really, really helpful. What will it do? It will list who they are. What's their mission statement if they have one? What services they offer? Do they have a board? Who sits on that board? Oh, look at that. Some really well-known MDs sit on that board. That's impressive. Huh. Okay. So see, there are little things you can find right away when you do a search that's going to help you determine, is this helpful, useful, true, and up-to-date information? Because cancer changes so quickly. We're going to talk about that in a minute. You want up-to-date information. The other thing I'd like you to look at when you've done that search and something comes up, look at the letters at the end of the web address. So when you see .edu, that's only allowed by educational systems. That's who can use .edu. Go Spartans, Michigan State. We're doing great this year. I'm so excited. So if you wanted to know about Michigan State, it would be michiganstate.edu or msu.edu. Okay, if it says .gov, it means the source of the information is the US government or comes from tribes, our tribal governments. Very important. If it's .com or .net, that means the site is run by a commercial or private source. It doesn't mean it's bad. Remember, we're not talking about that. It just means you have good information to understand where the information that site is sharing with you, where it comes from. It's not coming from one of our universities, excuse me. It's not coming from the government or the tribal governments. It's coming either from a commercial or a private source. Isn't that good to know? Don't you want to know that? There is some confusion about .org. In the past, .org or .org, you'll hear it referred to, it used to mean the source was a nonprofit. I thought that was very helpful when I was looking for information to share with patients, to educate myself, to whatever. I needed information, especially in the cancer world, in the oncology world. Well, that's no longer the case. I'm not sure how that happened. It was a little confusing to me, but the domain .org got released, and really kind of anyone can use it now. So if we want to know if something is a nonprofit, and you want to know that, that's important to know. These are three really good sites. They will help you. And you can just put those in, and whatever site you're looking at should be listed there if they're a nonprofit. I hope that makes sense. Brett, does that make sense?
It does.
Okay, good. Thank you. Okay. So we're still on questions to ask. How do you know if it's a right site for you? How do you know if it's going to give you the information you need to be a more educated consumer or patient or loved one of a patient? Because that's going to make your treatment easier, because you're going to understand more. You'll be able to be an informed part of your healthcare team. Remember, that's what this is all about. So in the United States, the most reliable sources of health information tend to be either government agencies, hospitals, universities, major public health. The CDC comes to mind, especially with all we're going on right now, and health advocacy organizations. What are health advocacy organizations? Organizations such as Zero, the End of Prostate Cancer, the American Cancer Society, Susan G. Komen, Cancer Care in New York City. These are health advocacy organizations. And these groups use information, this is why you can trust them so reliably, that's reviewed by noted experts and updated often. Remember, I told you, oncology, especially healthcare in general, but especially in cancer, oncology is changing so rapidly that we want to make sure that what we're reading is up to date and appropriate. Makes sense, right? So along with is it a reliable source, we want to know what's the purpose of the site? What's the mission? You know, nonprofit organizations, advocacy organization, we all have mission statements, what we're about, why we exist. That's important to know if you're looking to this site or this organization or this nonprofit or whatever to get information. What's the mission there? Who runs the site? Websites designed to promote or sell products may be most likely to have slanted or inaccurate health information. Why do you think that is? Exactly. Because they're trying to sell you their product. So they're going to twist it a little. I mean, sometimes they're going to downright out and out lie about what they can do. What's the perfect example of this? Just show you how long I've been in the field. Many years ago, I'm talking 10 plus years ago, the big thing was oral calcium for men diagnosed with prostate cancer. You want to be on not just any calcium, oral calcium. And where do you get it? Off the shores of Okinawa in Japan, because this oral calcium is going to slow down your cancer growth in your prostate. Well, total lie, total fabrication, but it took our government, oh boy, quite a few years to shut that site down. You don't read about oral calcium anymore. So if the website's main purpose is to sell you products, it's only going to contain the information they want you to read, so you buy their product. So again, what's the purpose? What's the mission statement? Who wrote this and who's it written for? That'll help you go, this isn't very helpful for me. I think I'll keep going and look for something different. And then we want to know, what's the source? How is it documented? Can you tell where the information came from? Is it based on scientific facts? Are they quoting Not just there was a study. A study is just that. It's just a study. There was a clinical trial at UC San Diego, Moore's Cancer Center, and that clinical trial, after 20 years, 5 years, 2 years, with Dr. So-and-so, this is what they found. Makes sense, right? Is reliable. It's an .edu, National Cancer Institute-based cancer center, tells you exactly what they studied in a clinical and tested in a clinical trial, tells you who did that trial, how you can find information about them. So where did the information come from? Is it scientific fact, or is it my mother's brother's uncle? Well, he had lymphoma and he took this supplement and his lymphoma went away. Now, come on. No. And you know, many of us, this included myself, that was diagnosed with cancer. It's frightening. It's the 3 words you never, ever want to hear your doctor say to you: you have cancer. And depending on the type of cancer and the stage and the treatments available, some people feel very hopeless, very frightened. The question becomes, is this the end of my life? And people like that are very vulnerable. They're vulnerable to believe whatever they can, anyone they can, so that someone can tell them something good, not something bad. So we want to be very careful, and good information comes from studies that use very careful methods that we talked about. And the result really shows, hey, this is what we were testing. And those personal stories and experiences are very emotional. They're very personable, but you have to make sure what you're listening to, because the truth is, people's personal stories and experiences, they're very hard to check for accuracy. So again, what is the reputable website that lists the references from the scientific journals that support the information? They'll always be at the bottom, always at the bottom of a website that's claiming to have done a study, research, a clinical trial. Scroll down. Where did they get their information from? What reputable sites? And then lastly, does the information seem kind of biased? Does it seem only present one viewpoint, what one person thinks? So not a research study now, just information. What are you reading? You know, information, especially again about healthcare topics, should be very balanced, giving pros and cons, right? So what's a good example? Again, we started right at the beginning with that proton beam and prostate cancer. Come here. And well, if you go on that site, does the site tell you there's a lot of good in having radiation? Proton beam is a type of radiation, and having proton beam radiation for, let's say, prostate cancer. But does it also tell you the cons? Does it tell you what the side effects are? What you need to be concerned for with that kind of treatment? That would be very helpful for you to then make that decision on, is that information what I need to make a decision to know about my cancer and to make a decision about my treatment options? We're still on questions to ask. See, there's a lot to ask. There really is. You want to know, okay, so who reviewed the information? You know, who's looking at what you're reading? When you're on a site, a website, does it tell you how the information is reviewed to make sure it's correct information? I mean, is it reviewed by experts in the field, and how often? Again, what's the date? Very important to look at. Who wrote the material? The authors listed? Do they have credentials next to their name? Did any of you catch my credentials next to my name? How do you know I know what I'm talking about? This is really important. Consider doing a search on the authors and the experts to learn more about them. So, for instance, years ago, I had to have some ear surgery, way before I lived in California. How do we know who to ask? We relied on our primary care physician. who gave us the names of 2 or 3 doctors locally in the town I grew up in, New York, where I could go. Now, today, if I got that same info, I would be going on the internet to read about those 3 physicians. Where did they train? Where do they practice? Where's their office? And by the way, just a caveat, I don't read patient reviews of physicians. I really don't, because they are so biased and so subjective. I have a doctor right now that cares for me that I think the world of, that just recently, the other day, someone referred to them as Dr. Iceberg. That made me laugh, because I'm thinking, God, this doc is so warm and caring. So those patient reviews, trust me, they're not helpful. And then I've been saying this throughout these slides. How current is the information? How often do they update that information? In medicine, we know things change quickly. And in cancer, honestly, it can change daily with all that's going on right now with all the research. So what may have been standard of care even a year or 2 ago, it may no longer be the standard of care. I mean, for those of us of a certain age, we clearly remember when robotic surgery was something you might read in a fantasy comic book. Probably not even there, just about robots. Now, honestly, robotic surgery is so commonplace for so many different types of surgery. And this is just, it feels like it happened overnight. So web pages should have the date the information was posted. And if it's more than 2 years old, you might want to look and compare it to more recent information. And also in questions you want to ask when you're sitting in front of a computer, looking at a site, you also want to ask, do they collect information from me? Are they asking me, what's your name? Maybe just your age. What's your diagnosis? Got to stop for a minute and say, why are they asking me this information? Is it legitimate reason to ask me this information to fit the purpose? So here's a great example. I have an older sister who has had breast cancer twice. There's this huge national study, it's been going on for years, called the Sisters Study. When I first went on that site, they're trying to gather, why does one sister get breast cancer and the other sister doesn't, right? So again, and we update our information every year. So why are they asking me all this information? They ask me just crazy things like, do you live near power lines or a power plant? Do you live near a gas station? Do you live near a farm where there is a lot of farm work and dust in the air? Why are they asking me that? Well, it fit the purpose of the sister study because they're trying to figure out, my sister got cancer, but I didn't, breast cancer. How come? Do I live near farming where chemicals may have been used years ago or where fertilizer may be in the air? Excuse me. Do I live near high wires? Is there still some question about what kind of electricity is emitted and has that an effect? So all of that was information they needed for them to be able to continue their study. It was helpful. It fit the purpose. And read your site's privacy policy. Some sites will automatically place you on an email list or sell your information. You don't want that happening. You want to know, where's your information going? It's about you. It's your personal information. So I think that's really important to know. Okay, so we talked about some questions to ask. I hope it was helpful at the end. I know it's a lot of information. I'm happy to take questions and see if I can clarify anything that didn't make sense. So what do we do about warning signs? What are they? What are the warning signs you need to look for? And I absolutely love this information from the U.S. Federal Trade Commission. You can Google that, U.S. Federal Trade Commission, you can find that information. So if something is a scientific breakthrough, a miraculous cure, a secret ingredient, or an ancient remedy, Okay, red flags, red flags, red flags right away. Really, it's a scientific breakthrough, but nobody else is talking about it except that one website or a miraculous cure. Wow, you would think at least 60 Minutes would have done something on this miraculous cure. And I talked to you about coral calcium at the beginning, a secret ingredient or an ancient remedy. Honestly, these absolutely should make you go, no, I don't think so. And that claims that a product can cure, what was the one I saw the other night on the TV? I could not believe infomercial. I could not believe it. But this product was going, I mean, I don't know. It was going to kill your toenail fungus and your acne, whatever. It just was nonsense. So pay attention to that. Also, people have had miraculous, amazing results with no clear scientific data. Okay. Also, you can only get this product from one source, and you have to pay in advance for that product. Again, that's that coral calcium story I shared with you all. Claims of a money back guarantee. Be careful of these because it may seem like it's risk free, but it may be often impossible to actually get your money back. So all those are huge, important, helpful. I use these all the time. They're just ingrained. And when I'm looking at websites, what am I looking for? It automatically will go, oh, no, I don't think, let me move on. But the last is really, to me, probably one of the most important. A website that doesn't list the actual company name, street address, phone number, or contact information. If you can't find out who they are, where they are, how to reach them, it's bogus. Why would they not want you to be able to reach them? It's kind of weird. It'd be like shopping at Macy's, but you can't ever get hold of Macy's. Or go to the store. That just doesn't make any sense, does it? So watch out for those warning signs. I know, I had fun doing this and putting little thingies in there. I forget they're there sometimes. We talked about this. It's red flags. And you just want to step back and go, I don't know, I don't really think this can be trusted. Especially when you're looking at natural cancer treatments. Natural cancer treatments. There's my caution sign. First of all, I really want you to understand what complementary versus natural cancer treatments means. Okay? Complementary therapies, mind-body therapies like yoga, tai chi, meditation. We offer all of those at Eisenhower Lucy Curci Cancer Center. And guess what? So does every cancer center in the country. They're complementary. Look at the word. They're complementary. There've been studies. They've been proven to be helpful to lower anxiety, to increase mobility, to lessen stress. Alternative is a taken orally, topically, or intravenously, like traditional Chinese medicines, vitamins, minerals, and herbs. Botanicals as well are in there. They may improve comfort and quality of life, but they aren't substituted for and you have to be careful that they don't interfere with proven cancer treatments. So again, complementary are those mind-body. Alternative therapies might be helpful if the right people with the right training who know about cancer as well are giving them, and they might make you feel better, but you can't substitute them for regular cancer treatments, and you have to be sure they don't interfere with proven cancer treatments. And hey, the bottom line is they're expensive. Financial strain, that's a biggie. We know with cancer patients, and we've done studies, and even those with excellent insurance will often have anywhere from $2,000 to $25,000 out of pocket, even with insurance. So be careful what you're spending your money on as well. So again, There are complementary, there are alternative. Then we talk about natural cancer treatments. Natural therapies can interfere with chemotherapy or radiation, and they can make them less effective. So, amygdalin, it's derived from April kernel extracts and other fruits and nuts. It has been shown in laboratories to kill cancer. But what most people don't hear is that is also can cause cyanide poisoning. We've heard of patients receiving bee venom in the hopes of killing cancer. But if you have an undetected allergy, you have run the risk of anaphylaxis, of literally stopping breathing, of your system shutting down, which can be a life-threatening reaction to an unproven and dangerous natural cancer remedy. Some of you may remember the apricot. Laetrile was the brand name given to apricot treatments. And Martin Luther King's wife went to Mexico, Coretta Scott King, for some Laetrile treatments, which did not save her life. We've heard about extreme dieting. It's kind of all the rage right now. You know, it's just like fasting every other day, maybe, but it can be really dangerous. And then, come on, you guys, how many times have we heard cancer feeds sugar? Well, we know that obesity and high sugar intake can lead to obesity. And we know there may be some changes in eating a tremendous amount of sugar, which can be dangerous for those of us, changes to metabolism. But to say that cancer feeds the sugar just hasn't been proven yet. But this will lead folks to restrict calories again. This disrupts the body's metabolism. It can cause even malnutrition. And if you have malnutrition, if you get so thin, this really can interrupt cancer treatment, and it can actually affect cancer survival. You know that we weigh you every time you come into your cancer treatments, for those of you cancer patients listening? Yeah, we do. There's a reason. We want to watch that weight. We don't want you losing so much weight that your body can't handle the effects of cancer treatments. So very, very important. So this study was redone. It was done quite a while ago and then recently redone. 2019 from the American Cancer Society. So they redid the study, and we found that almost 40% of Americans believe cancer can be cured through alternative therapies alone. This survey was conducted by ASCO, American Society of Clinical Oncologists. Again, for those of you that are cancer patients, that's the professional organization your physicians belong to. You know, this was really alarming evidence. It should be alarming to all of us, but certainly was alarming to those of us who are providers and live in the oncology space to treat patients. Because we know that patients who use alternative therapies instead of standard cancer treatments have a much higher death rate. So we have to be careful and know the difference between terms like alternative and complementary, and to know what do they mean, because they describe many kinds of products and practices and treatments that just aren't part of standard traditional cancer treatment or standard traditional medicine. So alternative therapy refers to non-standard treatment alternative. It's the alternative. It's used in place of standard treatment. While complementary therapy, complements, usually means they're used alongside standard treatment. That can be very, very helpful. That yoga, that meditation, that massage, all of that really, really can help someone as they move through their cancer journey and treatment. So here we talk again, there's a lot of complementary medicine that is helpful and safe. They've been studied and restudied, and they continue to be studied. Meditation to reduce stress, Peppermint or ginger tea for nausea. I can share with you that as someone in my family had recently had belly surgery, and the ginger tea really, really helped. And they didn't have to take their nausea medication. The ginger tea really helped for them. Guided imagery, you know what the guided imagery is, don't you guys? Guided imagery is where you close your eyes, and usually it's someone talking to you, but you can talk to yourself and picture yourself in your favorite place. For me, that's a beach. And listen to the waves, see yourself walking, hear the seagulls overhead. That's just absolutely wonderful, wonderful to reduce stress and pain as well. Very helpful. Certainly, and I talk a lot in the groups I do and the patients I work with, and for myself, when you're getting a CT or an MRI, it can be really tough going into those machines. It can be really overwhelming going into those machines. For some, it's really scary. There's always something to relax you if you need it, a conventional medicine. But I have found before I even go in the CT machine, which I have to do a couple of times a year, before I even go in, I close my eyes and I start walking on the beach, or I start playing golf. The golf course I grew up on. And I picture myself driving up to the golf course, getting out, getting my clubs out, getting my golf shoes on, walking down to the first tee, teeing up the ball. That's all guided imagery. And I'm going to tell you, I never, ever, ever get past the third hole and the CT scan is over and I come out. So these are complementary medicines and they are so, so helpful. Here's a list for you. Acupuncture. There is some mild pain and types of nausea that acupuncture works phenomenally well with. Art and music therapy, biofeedback. These are devices we use to help people gain conscious control over physical processes. Biofeedback is used a lot, by the way, here at Eisenhower in our physical therapy department. They will use a form of biofeedback to help gentlemen after prostate surgery who may have some incontinence issues. They've had some really good results with that. Biofeedback can help people slow their heart rate, their blood pressure, all the things that cause tension. It's really wonderful, wonderful. Complementary medicine has been around for a very long time. Excuse me. Massage therapy. We know for a fact that massage therapy can decrease stress, anxiety, and depression. And some studies have shown that massage therapy actually it can increase alertness. For those of you with blood disorders or blood cancers, the leukemias and lymphomas, this is not for you without speaking with your physician first. Very important. We do it. The lymphatic massage, all of that, no, not unless your doctor tells you it is safe to do so. It makes sense, doesn't it? Prayer and spirituality, very important. Very, very important, especially for those who've grown up with that as part of their life and their lifestyle. And there's no question, Tai Chi and yoga, honestly, of all of these listed, Tai Chi and yoga, the two things, again, you're going to find in almost every cancer center and certainly in ours. As a matter of fact, you guys are going to hear this first, which I'm very excited about. We, as you all know, we're virtual. We're in this virtual world. I am right now due to the COVID and the challenges. So all of our programs right now are virtual. They're online, they're Zoom, or they're call-in, depending on what they are. Well, we are really excited to be bringing 3 different yoga experiences starting in the month of February online. We're going to be offering chair yoga. We're going to be offering gentle yoga. And we're going to be offering, and those are going to be offered weekly. And we're going to be offering a yoga for beginners workshop once a month. So the chair yoga and the gentle yoga, the 2 classes, are going to be offered on Tuesday for chair yoga, Thursday for gentle yoga, and stretch, by the way. It's gentle yoga and stretch, I believe. 10:30 to 11:30. Here's the thing about these 2 classes. You can only attend with a physician referral. only attend with a physician referral, because we want to make sure your doctors who are treating your cancer, or if you're a cancer survivor and not in active treatment, your primary care physicians think that doing yoga, whether it's chair yoga or simple gentle yoga and stretch on a mat on the floor, that that's safe for you. The yoga beginner workshop, that's once a month. Anyone can join that. But there'll be lots of information. We can talk about it at the end of this. There'll be ads in the local paper and on Eisenhower's website. So just thought I'd share that with you. We're very excited about it. So warning signs, again, very important. What are you reading? What are you listening to? What are people telling you? What's on the internet? So if you're thinking about using any methods that aren't standard-based medical treatment that your providers are giving you or have sight over, then it's important to talk to your healthcare team first. And be careful, watch out for these warning signs. Anyone that claims they can cure cancer or any difficult to treat disease, chronic fatigue, MS, AIDS, I can cure that. You take this and you'll be cured. Those claims have not been proven. Be wary. And then if it offers benefits with no side effects, you can do this, you will have absolutely no side effects. Well, guess what? Even herbs, vitamins, over-the-counter medicines you and me, we take every day, they have possible side effects. If it's treatment and they say there are absolutely no side effects, then it hasn't been rigorously studied and it hasn't been declared safe, because that's where side effects come up. Okay. Promoters, they attack the medical or scientific community. Aren't we seeing a lot of that right now and hearing a lot of this right now? I think I read in the paper sometime this week that the second or third person who has been vocal in the fact that vaccines are bogus and COVID won't kill you has died from COVID. So be thoughtful, be careful. And then clinics that you can only get that treatment in that clinic and nowhere else. Why is that? Isn't that kind of strange? If it were really a good treatment, wouldn't they want a bunch of clinics? It's okay to make money. Nothing wrong with making money, but why is it only in that one place? You can only get it there. What are they up to? Watch those warning signs. It's really important. Okay, and we talked about this. Oh, I feel like I went backwards. I think I did. There we go. Oh, well, maybe I have two slides that are exactly the same. My apologies. So, wow, a lot of information, correct? And a lot to be aware of. Where's the information? Who's selling it to you? Tricks of the trade, what to look for to make sure you're getting good information. That's a lot, right? We also, nowadays, with social media, have a tremendous amount of offerings in online support groups and chat rooms. Now, online peer support groups, peer-to-peer, person-to-person, they're not facilitated by an oncology professional, are groups of people who share their information and their experiences and support over the internet through chat rooms, discussion boards, mailing lists, right? These are great websites. I'm not saying they're terrible websites, because they allow people to connect with others like them. But they also allow a person to keep their real identity private if they want to do so. Okay. And you might find some of these groups, chat rooms, discussion boards helpful, but make sure that the information people are giving to you, hey, I did this. I did this for my esophageal cancer because it was really hard to swallow when I was getting radiation. This was really helpful. That could be great information for you. Just make sure you share it with your healthcare team, so to make sure that it applies to you in your situation. Doesn't that make sense? And be careful of those who just want to listen to themselves and they love the attention of you listening to them. Now, this isn't to say that you shouldn't trust anything on the internet. Just be careful, be cautious, be thoughtful. And here's another caveat. Even on the most trusted, highly regarded websites, this is very general information. Very general information. It may not apply to you at all. You know, the treatment and care of cancer patients today has changed tremendously. One of the biggest changes is you have all heard this, the term personalized medicine. Personalized medicine. Medicine for the person, not for the group, not for everybody. Personalized medicine. Well, what does that mean? Well, for any of us that have been diagnosed with cancer in the last, let's make it 3 to 5 years, probably 2 to 4 years, but either one will work. Any one of us diagnosed, most of us will hear, well, we want to talk about the genetic makeup of your tumor cells. We want to do some genetic testing, not testing to see if it came from mom or dad. That's called germline inherited risk for developing a certain cancer, although that's really important to know, and we do that. No, we're talking about the genetic makeup of your cancer cells, the personalized makeup of your particular cancer cell. What is there? Because then we can start to look at what specific treatments might work for your specific genetic makeup. So we found out that, lo and behold, lung cancer. There isn't just one lung cancer. There are two lung cancers, small cell lung cancer and non-small cell lung cancer. And guess what we also found out? In non-small cell lung cancer, there's lots of different genetic mutations making up those non-small cell lung cancer tumors. And you know what else we found out? There are certain drugs that work better on certain of those genetic mutations, but don't work as well on other genetic mutations. Do you see what I'm getting at? It's your personalized genetic information in your cancer tumors or cells, for those of you who have cancer. And this is going to, believe me, this is already starting, but it will spread into almost every diagnosis at some point or another. So information on the web, they don't know any of that. It's general information, and it may not apply to you. If you don't know the genetic makeup of your tumor cells, who remembers that? Our doctors do. We don't necessarily. That's why take this information, share it with your healthcare team. Don't let information on the internet take the place of medical advice. There is no way to get the experience, even if it's telemedicine today, even if it's telemedicine, in talking with your doctor, looking at your health history, your unique medical situation, and talk with you about how you've been feeling. That doesn't happen on the internet. That's hugely, hugely important. Well, Brett, if you saw, I kind of pushed forward and ended up with a blank slide there. So I think we have time for questions if there are any.